Check out this dude, Sarah McBride, who dresses up like a lady. I mean, honestly, you have to have a broken brain to think that everything is fine with Obamacare and think that there's no fraud in it. And that apparently is the situation here. I mean, there may be more evidence of some brain damage with Sarah McBride, but let's just start with the open denial of reality. Democrats are demanding more subsidy bailouts for the health insurance corporations. They claim it's to help you with your premiums with Obamacare. And they're right. It will help you, I suppose, by funneling a ton of money to the insurance companies. So the insurance companies don't charge you the money, but it's really a gift to them. At least the Democrats acknowledge, though, that Obamacare, the Affordable Care Act, is not affordable. It's broken. But their only solution is to just keep on keeping on and taking tax dollars that we don't have to prop this thing up. Well, Republicans have a better idea. Speaker Johnson earlier today.
A new report by the Government Accountability Office, which I haven't seen too much written about yet. You should look into that. It is an eye-opener as well. It makes clear why it would be a dereliction of duty to just extend subsidies without massive reforms to them. Okay, over the last 2 years, this is investigators at the Government Accountability Office. Okay, they submitted 24 fraudulent applications for the ACA subsidies, the Unaffordable Care Act subsidies, Obamacare. Okay, of the 24 fraudulent applications that they created intentionally to just see what would happen, 23 of them were approved. These applications were completely fraudulent. The investigators did not submit any Social Security numbers, citizenship documentation, or reported income documents. And 23 of the 24 applications were still approved. 18 of those, by the way, are still receiving coverages. They were as of September of this year. That means the Obamacare exchange and insurers didn't verify any of the information they're supposed to under the law, and they proceeded to pay tens of thousands of dollars to insurance companies for people who do not exist. Okay. The GAO report also found that 29,000 Social Security numbers in 2023 and 68,000 in 2024 were used to receive more than 1 year's worth of insurance coverage. In other words, multiple people were utilizing the same Social Security numbers to openly defraud the American taxpayers. The GAO also found that more than 94 million was sent to insurers on behalf of dead people. Okay, this is the system that Democrats in Congress want to extend without reform. It's unbelievable.
It is unbelievable. And Republicans' message is very simple. Fix the fraud first. Not one more tax dollar until you fix the fraud first. Now, they're going to come up with some more ideas about how to fix the health care and health insurance problem in this country that Democrats have broken. And they're going to roll out a lot of ideas. For instance, until they can completely reform the package, at the very least, let's start by sending the money to you and start a health savings account for you in your name that the government will fund. You can then take that money and you get to buy directly from the insurance company instead of sending the money to the insurance company where they're going to take their overhead and prop it off the top before they start delivering you services. Get back to an open market concept here where you can compete and you make the insurance companies earn and win your business. There's a concept. The Democrats want nothing to do with that. And they're in denial about the palpable fraud that exists in this system. Johnson pivoted and turned his sights on the Democrats here.
Let's be very clear about one thing. When the Democrats talk about healthcare affordability, okay, this catchphrase that they have, they are talking about one thing and one thing only. They are talking about continuing handouts to big insurance companies. They have no ideas, they have no desire to fix the broken system they created. They just want to subsidize it. And subsidy is a big word. It means they're taking taxpayer dollars and funding a broken system. That is their entire affordability agenda in a nutshell. This agenda does not lower healthcare costs. All it does is hide the cost of the failed law, which we assume is the point. And their proposal, which is a 3-year extension of these enhanced subsidies, the Democrat COVID subsidies that they created, that they put the expiration date on for this December. That proposal to extend that for 3 years is devoid of any reforms to clamp down on the rampant waste, fraud, and abuse And it continues to provide taxpayer-subsidized health care to Americans who are making hundreds of thousands of dollars in annual salary. It doesn't make any sense. Now,
it makes no sense unless you're a Democrat. And by the way, do the math here. They want to extend these subsidies, the COVID era subsidies that were put in place because of the COVID pandemic emergency, and they want to extend it for 3 more years. Do the math. Figure out when these are going to expire and then overlay those dates with the next presidential election, and you'll see exactly what they're trying to do. Obamacare is broken, and it's broken because Democrats broke it. Excuse me. Healthcare in America is broken because Democrats broke it with Obamacare. Let me give you a list really quickly of all of the Republicans that voted for Obamacare that led to the dismantling and destruction and sky-high rates you're now paying for health insurance in America. Here we go. Are you ready? Do you have a pen and paper ready to write down these names? Here are the names of all the Republicans who voted for this. That's it. Not one. This is entirely the Democrats' disaster. They made this thing. It's like they built the Titanic, designed the Titanic, sailed the Titanic, hit the iceberg, and then as the Titanic is sinking, they're on the deck of the ship saying, why in the hell aren't Republicans fixing this? Or even worse, they're going down with the ship and pretending that everything's fine. Check out this dude, Sarah McBride, who dresses up like a lady. I mean, honestly, you have to have a broken brain to think that everything is fine with Obamacare and think that there's no fraud in it. And that apparently is the situation here. I mean, there may be more evidence of some brain damage with Sarah McBride, but let's just start with the open denial of reality. A reporter confronted Congressperson McBride on the GAO report showing this rampant fraud. And what was the response?
Government watchdog group set up a number of fake accounts and discovered that 90% of Obamacare subsidies were actually granted without any documentation, no social security number, no income verification. What do you make of this? And why do you guys want to continue to extend a program that's clearly failed the American people, especially for another 3 years?
Well, I don't think the American people think that it's failed the American people, and that study, quote unquote, sounds like bullshit.
Well, it's right here. I actually have it.
Yeah, but it sounds like a bullshit study, not a bullshit methodology.
So because it sounds like BS, you just say that it's no good? I mean, I can show you it right here. New York Times reported on it.
Sounds like the methodology is pretty questionable.
All right, well, it's right here. Obamacare subsidies granted without documentation, 90% fraud rate.
That's a 90. First of all, that's not what that says, and you can mischaracterize what a report says, but that's not what it says. It does not say that there's a 90% fraud rate.
90% of fake accounts set up by government watchdog group.
That's
Speaker Johnson and Thune have been sounding the alarm on this for the last couple of days ever since it was discovered. Any response to them talking about it?
Well, first of all, if they want to work with us and add in measures around verification for the ACA tax credits, we're ready to negotiate. But Mike Johnson has been nowhere to be seen when it comes to negotiating a path forward on this healthcare crisis, including skyrocketing premiums because of the expiration of the ACA tax credits.
So you guys are dead set on the 3 years. I mean, would you come to a compromise if it was 2 years, 1 year?
We've said that we are willing to work with anyone who's willing to seriously come to the table in good faith to extend the ACA tax credits. Our proposal, which is 4 signatures away from a discharge petition being successful to force a vote, is 3 years. But there are other proposals on the table. Again, leadership needs to actually come to the table, be serious, and negotiate. Government requires compromise, but Republicans are nowhere to be found in leadership when it comes to that compromise and that conversation.
Yeah, manly walk on that dude, by the way. I have to say, that's an impressive stride, although I think I may have seen a bulge. And I want to give kudos to whoever the camera person was. Ain't easy to do that walking backwards, right? Wow. What was that last thing McBride said? Government requires compromise. Can I remind you again how we got stuck with this mess? What kind of compromise was made when we passed this bill in the first place? How did you compromise with? No. So the Democrats are now demanding compromise from Republicans to fix what they broke without one Republican vote. They refused compromise when they up our healthcare system, and now they're oh well, government requires compromise. But let's go back to what the hormone-infused vocal box said there when confronted with the report from the General Accounting Office.
Government watchdog group set up a number of fake accounts and discovered that 90% of Obamacare subsidies were actually granted without any documentation, no social security number, no income verification. What do you make of this? And why do you guys want to continue to extend a program that's clearly failed the American people, especially for another 3 years?
Well, I don't think the American people think that it's failed the American people, and that study, quote unquote, sounds like bull.
It sounds like BS. Okay, let's play that game for a moment. It came from the General Accounting Office, the GAO. Here's the GAO's website. It's a nonpartisan, fact-based government accountability office. This is not some think tank. It's not some right-wing bastion. In fact, most of the studies they do, as is typical for a nonpartisan independent agency of the federal government, is basically set up to harm Republicans and conservative. That's the problem with these so-called nonpartisan independent groups in Washington, D.C. that are affiliated with the federal government. But in this case, the GAO actually was honest. I mean, you can't fudge these numbers. 90% of the fake accounts that were set up to test the system were approved and funded. Nobody's watching the store with regard to Obamacare and the Affordable Care Act. Billions of dollars in fraud. And Democrats are fine with that. It's part of the system. Don't believe me? Well, here's one of their stars, their leaders, Jasmine Crockett, speaking of the fraud issue yesterday.
I do want to make sure that I cover one other thing that the chairman spoke about. He specifically said that he's concerned about the fraud. He's not giving us numbers, but I can give you some numbers. If we're concerned about how much money it may be costing us because systems are not perfect, we have no perfect systems. We have always had some level of fraud in anything that we have because there's no such thing as perfection walking on this earth. I do want—
There you go. Oh, the chairman's worried about fraud. Well, listen, nobody's perfect. Something tells you, how many of you utilize apps on your smartphone to do your banking? I do. I get my paychecks direct deposited in my bank account. I can check my deposits. I can pay bills from my smartphone. My credit card statements come through that way. I can't remember the last time I wrote a check and mailed it. You do it all online. You do it all through your apps. You want to bet that the people responsible for whatever banking system you use and whatever credit cards you use and how you pay your bills, you want to bet that they put measures in place to ensure that there's no fraud in those transactions? I know they do. I bet you they do. But the government doesn't, because it's not their money. They don't care. She doesn't care. The Democrats don't care. This is their program, and they don't care. And the second Republicans try to fix the fraud and actually trim the budgets and say, we're not going to spend all of this lousy money that people are defrauding us with until we fix the problem, what do they say? You're starving children. Grandma's going to die in the street because of you. No, it's because of you, because you've set up a fraudulent system. It's because of you. And it's obvious that that's what happens with government system. And Jasmine Crockett, hey, no system is perfect. What are you going to do? Hey, nobody's perfect. But the important thing is we got to do a big signing ceremony and we got to say, look, we're giving you health care. And meanwhile, they're not giving us health care. They've ruined health care. And I believe in our last clip there, Tim McBride, the dude that dresses like a chick there for Delaware, said, I think the American people don't think that Obamacare ruined healthcare. No, actually, the polls showed that they do. It's exactly what they think. How bad is the fraud? Here's quite a bit of it.
And right now, the Nonpartisan Government Accountability Office has revealed the ugly, ugly truth. They tested the ACA, and the ACA failed. The GAO created fake applicants, get this, They created fake applicants using fictitious identities, missing documents, and questionable personal information. The system approved them all anyway. These imaginary enrollees received tens of thousands of taxpayer dollars month after month, even though they didn't exist. No verified identity, no proof of citizenship, no income documentation, nothing.
Yeah, and yet, what was Jasmine Crockett's response again? I just want to see it one more time. By the way, this is from several months ago, I believe, but it certainly hits home today during the debate.
I want to make sure that I cover one other thing that the chairman spoke about. He specifically said that he's concerned about the fraud. He's not giving us numbers, but I can give you some numbers. If we're concerned about how much money it may be costing us because systems are not perfect, we have no perfect systems. We have always had some level of fraud in anything that we have.
There you go. So listen, here's my advice, Joe. It's actually, no, forget that I said that. It's not my advice. I am not advising you in any way whatsoever in this regard, okay? So please, I disavow this. But apparently this is Jasmine Crockett's advice. If the IRS sends you a letter about your tax return and they found some anomalies maybe in how you calculated your taxes owed or the size of your refund, and they send you a notice that maybe, you got it wrong and you need to pony up some money and some penalties, here's what you should do. According to Jasmine Crockett, you should say, hey, Congresswoman Jasmine Crockett said no system is perfect. There's always some level of fraud, right? So, I mean, what do you want from me? Sitting Congresswoman, Democrats all across the board yesterday poo-pooing fraud in the Obamacare system. You try that with your taxes. They seem fine with fraud when it's the program they create, they fund, and they celebrate, and that they demand you continue to fund even though it's broken and upside down and ass backwards. But boy, the second you have 50 cents due on your taxes, good luck. Good luck. Good luck overlooking that fraud, broken system. Things happen. Yeah. Try that. Don't try that.
Dennis next in New York, Republican line. Go ahead, Dennis.
Yes, I'm a veteran collecting Medicare. I've been trying to get cholesterol and blood pressure medicine under the Biden administration since 2021 to 2024. And I always had a hard time getting a prescription refilled or anything else. It got to the point I actually went down to the office in Western New York Medical. The whole room was filled with illegal immigrants going in and out. I couldn't even get to the counter to get a refill on prescription cholesterol and blood pressure medicine. Anyhow, long story short, a month ago, I was rushed into the hospital with heart failure and that, and I get there, and for the last 6 months, I come to find out that I got kidney failure and congestive heart failure. Not one doctor from Western New York Medical called to notify me. They knew about this for over a year, and now here I am, and I listen to you Democrats saying that illegal immigrants weren't collecting Medicare and it wasn't hurting the American people. I'm dying right now because of them illegal immigrants getting in line before me, and our medical system and our healthcare system didn't even call to notify me to let me know about this a year ago. Do you have a response for your party and what they're doing to the American people?
Well, let me say I'm sorry for your health problems, and you should have gone to your member of Congress and asked him to help intervene for you with Medicare, but Biden's gone, so let's talk about what you can do in the future. As far as blaming on the immigrants, U.S. law says that immigrants do not qualify for Medicare, so I don't know who is in front of you in line, but let's look at what caused your problem, see if we can help solve it now instead of just blaming other people.
Yeah, you know what, Democrats, you go with that messaging. You go with that. I think that's brilliant. Hey, the law says that those, and she refused to say illegal immigrants, you notice. The law says that, immigrants aren't entitled to Medicare. So who are you going to believe? Me? Democrat Congresswoman sitting here in the Cannon office building, Rotunda, or your lying eyes when you're sitting there in the waiting room?
The law also says they're not allowed to enter the country.
Yeah, thank you. We have federal laws against that sort of thing. How are those working out? Well spotted, Kevin McMahon. That's why you're here. That's why.
Let me set the record straight. Obamacare is a complete failure. We are a decade and a half into the so-called Patient Protection and Affordable Care Act, a bill that was promised to the American people as a solution to lower healthcare spending. But patients have not been protected, and healthcare certainly has not become more affordable. Since Obamacare was fully implemented in 2014, healthcare premiums have risen 129%, over 3 times the rate of inflation during the same period.
All of those are facts. It's undeniable. We can't make up data like this. Everybody knows that since the Obamacare was voted in and passed, the costs have absolutely skyrocketed, because that's what always happens when government creates a monopoly and finances the monopoly. And you don't have any choice. Again, I just want to reiterate, if you're a young person, I'm a Gen Xer, okay? Back when I was 20, 21, 22, and I was in the workforce, and you could either get a job that didn't offer health insurance and just sort of roll the dice and assume, I'll be fine, which a lot of people did, by the way. Or you can do what I did. I got a job that had a basic health insurance program for somebody my age. And it was a catastrophic plan that if, God forbid, I got into a car accident, hit by a car, fell out of a window in a building in New York, or got diagnosed with cancer, then yeah, I'd have a major medical program and the deductible would take care of that. But all the other stuff, my checkups, I need some antibiotics, I want to go get a physical or whatever, sprain my ankle playing basketball, that happened. That's out of pocket. I'll take care of that stuff, right? And it didn't cost much of anything. You can't get something like that right now. If you're 22 years old and you need health insurance, you get the same kind of plan that a 60-year-old gets right now, with everything covered, including all of your transgender procedures that you need, don't you know? And that's because of Obamacare. And it was a gift to the insurance companies. And when you look at the rates and you look at the costs and you look at the numbers and you look at the profits, last I checked, I thought Democrats were excited when the CEO of a health insurance company got assassinated in the streets of New York. Well, you can understand why people are upset. They're great at rationalizing murder, aren't they, for their own political purposes? But the irony here is that the anger that some people might have, that certainly doesn't justify murder, but the anger that people might have against insurance companies, that was created by the left. They created this atmosphere. And now they're propping it up, and even worse, in light of the data and the statistics and the facts and common sense about how we got here, they're in complete denial.
I will maybe just ask this one question of you, which really goes to this issue of what happens if we don't have healthcare coverage for everyone. Because one of the arguments that I hear is somehow that the ACA made healthcare more expensive. And maybe you could comment on the value of having more people covered, or in the optimal world, having everybody covered, people would have to opt out of coverage, let's say. But what is the value in terms of not only healthcare for people who need it, but also in terms of the expense of our healthcare system?
Did you see that Senator Maggie Hassan there saying, I don't know, so somehow I'm hearing this narrative that health insurance is more expensive because of the Affordable Care Act. I mean, how is that possible? Affordable is right there in the name. It's the Affordable Care Act. So obviously it made health insurance more affordable, right? Right? Honestly, you have to be a complete and total idiot, or the worst possible liar, to be a leader in the Democrat Party right now during this debate. And yes, I know, as always, we always hold open the possibility that it could be both.